Hello and welcome back to the third lecture. This is going to be the third part for our series on the anatomy and physiology of the cardiovascular system. I hope you are excited and ready for a heart-pounding lecture. We'll just go over what we've covered so far. So in part one, if you recall, we talked about the cardiovascular system, and this was just a general introduction to what the cardiovascular system is. And remember, we talked about some key topics here, specifically what is the function and purpose of the heart. And we said in general, the purpose of the heart is just to deliver oxygen to the body. And we have this second function of also removing carbon dioxide from the rest of the body. So in combination, we see this being done through the arteries, arterioles, and capillaries, and that's how oxygen gets delivered to the body. And then on the other side, with the return of carbon dioxide, we see it going through the veins, venules, and the capillaries. And we said in combination, this makes up the cardiovascular system. And then when we look at the second part of our discussion, we then started discussing hemodynamics. And this is where we started discussing about structure and function. So the anatomy and physiology of the heart. What does the heart look like and what does it actually do? And one of the key topics we talked about, if you look on here, we talked about how we have these chambers. There are four chambers that we have in the heart. So let me just put the highlighter here. And there are the four chambers. And here we have those chambers that have been selected. And we have two atriums, I should say atria. So one atrium on the right side and one atrium on the left side. And if we go below, we have these other chambers, which are larger, and that is the ventricle. So we have the right ventricle and the left ventricle. In combination, those are the four chambers of the heart. And then we said that there are these four valves that act as doors. So we said the heart is like a house. And in each room are these chambers, and we have these valves which act as doors that allow blood to flow through the heart. Specifically, there are four valves we spoke about, and two of those live between the atrium and then the ventricle. Those are your atrioventricular valves. And on the right, remember, try before you buy, we have the tricuspid valve. And then on the left side, we have the bicuspid valve. And then we didn't say this term, but this is what these two are classified as: semilunar valves. And those semilunar valves, we have two of those. One that is going from the left ventricle to the aorta, and that's called the aortic valve. And then the other is the right ventricle, between the right ventricle and the pulmonic artery. So that's a spelling error there. It should be valve. And that's the pulmonic valve. So we then moved and discussed about how the heart has two different phases. And as the heart, blood is moving through the heart, there are these two phases, and we have systole and diastole. Specifically with diastole, this is the process where blood is filling in the heart. And diastole actually occurs not only in the ventricle, but also in the atrium. But we're going to just focus on the ventricle. And we discussed ventricular diastole, and that's where the ventricles are filling with blood and when they're relaxing. And then we spoke about ventricular systole. And with systole, this is just the phase where the heart is contracting and then pushing blood out. So we talked about how the heart will fill up and then it'll pump out blood. And here I'm just demonstrating how with diastole, blood's filling the heart. You can see the heart being larger. And then with systole, the heart contracts, blood leaves, and the heart size actually gets smaller. And then when we look at the hemodynamics of how blood flows, that's a very important topic of this systole and diastole, because we said the combination of this systole and diastole makes up the cardiac cycle. And if you remember, the cardiac cycle is one cycle of filling and then ejection of blood. And we spoke about some general rules regarding hemodynamics and how blood is moving through the heart. And this was important because this is going to help us understand what we talk about today and some of the disease processes. In general, we said that the hemodynamics, so the flow of blood through the heart, is a mostly active process. And that is being driven by the myocardium. So remember, that's the layer, the middle layer of the heart with the muscle. And then the second rule was that it's pressure driven. And we're typically going from a high to a low pressure area. So this means that we need the next area, the next chamber that we're going to have a lower pressure. And that allows the blood to flow to that area. And then we talked about this principle of fill first and then pump next. And this will be very important when we talk about some of the different hemodynamics and physiology for today. And then we talked about left and right synchrony, just meaning that the left and right side are working together. It's not one side going first and then the other. Both are working together. And this last one is very important. There is no backflow of blood in the heart. Everything is always going in one direction. There's a constant one-way flow. Those valves, those doors shut behind and keep blood from going backwards. So very important to note that there's no backflow of blood. So for today, these are the terms that we need to go over that I want you to become familiar with after we go over this topic. And starting with central and peripheral, I introduced this topic of central versus peripheral. And in the prior lecture, we talked about central hemodynamics, how the blood is actually moving through the heart. We'll build on that topic, but I want to introduce the peripheral system. Remember, cardiovascular. We've spoken about the cardiac side. Now I want to discuss the peripheral, which is the vascular component. And when we look at the hemodynamics, we're going to have two phases. Centrally, like we mentioned, the blood flowing through the heart, and then peripherally, and we already introduced the arterial and venous system. And this diagram here is just showing a bundle of all of these arteries and veins that are going throughout the body. Centrally, we have the heart. We already discussed how the blood is flowing through, but we also see how these networks, remember, we spoke about how they're like road networks, and the heart is the central hub. And you have blood that's leaving the central hub, going to all these different tissues, versus you have the veins coming back from those tissues and sending blood all the way back to the central hub. So those are the two breakdowns of the system when we look at the circulatory system. And when we look at a simplified view of the circulatory system, because in that previous view, all of the veins and arteries are everywhere. But here we can really simplify it. When we simplify it, there's going to be two areas that the blood is going to once it leaves the heart. The first is the lungs. So we see the pulmonary circulation. And the other part is to the rest of the body. And that is going to be the systemic circulation. And as we can see here, the heart, the blood leaves. And on this middle part, we see the lungs. And what's going on in the lungs is that we're having the blood that came in from the rest of the bodies through the vein. It's going into the lungs. And remember, that has carbon dioxide from the body. And that blood is going to then go through a process of gas exchange, where it's going to push out the carbon dioxide into the lungs that allows us to breathe it out. And the air that we're breathing in contains oxygen. That's going to then replace the carbon dioxide and go into our red blood cells that then go back into the heart. And then the heart's able to push that out and go to the rest of the body. And that's where we get our systemic circulation. So that process of gas exchange that's occurring at the level of the lungs, that is called external respiration. Versus when that gas, that oxygen that's being carried in the blood, it then goes to all of the tissues. And remember, it goes down from the arteries to the arterioles and then to the capillaries where it's exchanged, where there's gas exchange at the tissues. And remember, the body, the heart just beats. It's only there to supply blood, and the blood contains oxygen. And this is the reason here, because tissues require oxygen. They require oxygen for energy, so they're going to take oxygen out of the blood, and CO2, carbon dioxide, is going to be a byproduct from the activity and the energy that they created. So at this level of the tissue, we see another gas exchange that occurs. This gas exchange here is called internal respiration. And that gas exchange, oxygen is going to go into the tissue, carbon dioxide goes into the capillaries, which then goes into the venules, which then goes into the veins, and then goes all the way back to the heart. And this cycle just continues. The other part of the circulation that we're going to see blood go to is the heart itself. Now, the heart has its own blood vessels supplying blood and oxygen, and also blood vessels that are taking the blood and carbon dioxide back to the heart. And it's very important because this is how the heart sustains its function. And actually, what's going to happen is as the blood is leaving the aorta, part of that blood is going to go into these arteries, and these are called coronary arteries. Now, it's very important to just keep in mind that these are the three main arteries, because when we start talking about pathology and the pathophysiology, this is going to come back with heart disease because this is where we see issues. So remember, the heart is just like the rest of the body. It needs oxygen to generate energy and to function properly. It's also creating carbon dioxide, which needs to get taken away. So these arteries are going to be very important for maintaining the function of the heart. So keep that in the back of your mind as we go forward, because there's a lot of tissue, obviously, that the heart has to supply blood to. So how do we know if the heart can pump out enough blood? Well, to do this, we need to dive deeper into this physiology. And to answer this question, we need to remember what a cardiac cycle is. If you remember, the cardiac cycle is where we have diastole and systole. Once again, that's coming back up, right? So that cycle of diastole and systole counts as one cardiac cycle, which is one beat. That is cardiac cycle. And it turns out that if we had a bucket and collected the blood that is pumped out of the heart with each beat, we will get the stroke volume. It is important to remember that the amount of blood pumped out of the heart is the result of a full cardiac cycle, or one heartbeat. And this requires a systolic and diastolic phase. So as the heart goes through one cardiac cycle, blood is going to come out of the heart. If I had a bucket, I'll collect that amount. And if we measure how much blood was in that bucket, that will give us stroke volume. Stroke volume is just with one beat, the amount in one beat. So what then happens if we collected each stroke volume in the bucket each time the heart beat? Well, if we do that, we will get cardiac output. So we can add those up. So each time the heart beats, we collect it. And we just keep collecting that each time. And this new value we get is called cardiac output. And with cardiac output, we're seeing how much blood the heart's going to pump out in 1 minute. Stroke volume is just how much blood the heart is pumping in one beat, versus cardiac output is how much blood the heart is pumping over a minute. So instead of this process of just collecting stroke volume each time it pumps, what will be an easier method for us to determine cardiac output? What do you think? In this process, we're collecting the stroke volume each time, right? And we're going to add it all up to see what the total amount is in 1 minute. Well, instead of doing that, if we know how many times the heart beats in a minute, and we know how much volume the heart pumps out with each beat, which is the stroke volume, we can then determine how much blood it will pump in a minute. And that gives us this equation. And this equation here is the equation for stroke volume. And we know what the heart rate is, and the heart rate is how many times the heart beats in a minute, or how fast the heart is beating. And remember, once again, the stroke volume is how much blood comes out. So when we multiply these two, we get cardiac output. So if we look at this example here, we're using an example where the heart is potentially beating at 2 beats per minute. So in a minute, the heart's going to beat twice. So we'll have 2 cardiac cycles there. And the stroke volume is 0.05 liters. So if we take that and we multiply it, it means that in 1 minute, we had 0.1 liters that was put out in that minute. So this is just an example. It's not a real amount. You'll be dead if your cardiac output was this low. So we had that question of how much blood can the heart pump? And understanding this equation gets us a little closer to answering the question of how much blood the heart can pump. And we can either look at how much blood it pumps with a single beat, or we can see how much blood it pumps over a period of 1 minute. So we have 2 ways to answer that question, with each beat or over a period of 1 minute. And remember, 1 cardiac cycle requires what? Systolic and diastolic phase. It requires fill-in before ejection. So I don't want you to focus so much on the calculations, but if you understand this concept of the heart fill-in before it contracts and how that changes with stroke volume and also with heart rate, which then gives you cardiac output, if you understand that concept, you are 70% of the way there. I'm just going to give you another example to demonstrate how stroke volume and heart rate can change the amount of blood the heart pumps. So I want to try writing the equation. I want you, right, to try writing the equation for this. So given the heart rate and given the stroke volume, can you write out and solve what the stroke volume will be? So you can pause and then see the answer. And the answer for this is going to be 3 liters per minute. So we know the heart rate is 60 beats per minute, and we know the stroke volume, which is 0.05 liters. And then in both examples, if we look at how the changes occurred, we see that the heart rate changed. And we can see from one scenario where we had 2 beats per minute to the other scenario where we had 60 beats per minute, the cardiac output changed even though the stroke volume stayed the same. So what does that tell us? That tells us that if our heart's beating faster, we can have more cardiac output. So each cycle, the heart fills, pushes out. The heart fills, pushes out. So as the heart grows big, that's the diastolic phase. It gets smaller, it's pushing the blood out. So if the heart starts going faster, we can increase cardiac output. And then if we look at the stroke volume, we can see that by changing the amount of blood that the heart pumps out with each beat will affect cardiac output. So specifically here, I've increased in the second example from 0.05 liters to 0.5 liters. And we can see even though the heart rate stays the same, cardiac output is going to change from 3 to 30. So this just gives you a demonstration of what happens when not only heart rate, but also stroke volume changes and how that affects cardiac output. So now, see if you can explain this answer to a friend now that we've gone over all of this information. Try seeing if you can explain it in your own ways, in your own words to a friend or to a patient during your clinical. And now that we know what variables affect the amount of blood the heart pumps, we can now talk about factors that influence these variables, starting with HR. So with heart rate, we see that the autonomic nervous system is going to affect heart rate. Specifically, we see influence from the sympathetic nervous system and also from the parasympathetic nervous system. And what we see with the sympathetic nervous system, this is your fight or flight, right? So it's going to ramp things up. and it's going to release norepinephrine or epinephrine and cause the heart rate to increase. Whereas if we have stimulation from the parasympathetic nervous system, this is going to make you chill out. It's going to slow your heart rate down, and you're going to be, in a chiller mode, I guess. Right? And then seeing that the job of the body is to supply oxygen, what would happen when the body needs more oxygen? How would you answer this question? Well, it will need to increase the supply of blood, right? Because that's the job of the heart. And by increasing the supply of blood, we increase the supply of oxygen. So, in that scenario, the sympathetic nervous system will actually act on the heart to increase heart rate. And when we are in a relaxed state, we don't need as much oxygen, right? We're just chilling out. So, the parasympathetic nervous system will kick in to slow down our heart rate. So, this change in how the autonomic system is influencing the heart through the sympathetic nervous system or parasympathetic nervous system will then affect the heart rate. So the other variable that's affecting cardiac output is stroke volume. And this is more susceptible to other factors. So if you recall, the cardiac cycle has two phases, the fill-in and ejection, diastole and systole. You can't forget it. I've mentioned it like 50 times now. It so turns out that this becomes important for determining the stroke volume. And I like to think of the heart like a bank. And in your bank account, you have your bank account and you know how much is in there. And just like you can only withdraw what's in your bank account, the heart can only pump out from what is in there. The fill-in or diastolic phase will play such an important role for how much blood can leave the heart, which will be stroke volume. And this brings us to our next key term, venous return, because that component of blood coming back to the heart, that is called venous return, the amount of blood that comes back to the heart. So using the bank analogy, venous return is the deposit that is needed for the heart to withdraw the funds needed to support the body. Without these funds, the heart will not be able to eject blood out. Very important, which is why I went over the fact that we need those two phases. And then it turns out that stroke volume will change depending on how much blood is in the ventricle prior to contracting. This volume of blood that's in the heart is called preload, and it is measured at the end of diastole, which is right before systole. So that amount of blood that is filling the heart, that is called preload, and it's going to then determine how much blood leaves the heart. And then the relationship between preload and stroke volume is that when we increase preload, we will also increase stroke volume. So more in, more out. And using our analogy, if you put more money in the bank, you can withdraw more money. And the converse is true. Reduced preload will reduce the stroke volume. So dehydration or massive bleeds are common causes of reduced preload. And when we see those scenarios where preload is reduced, there's going to be poor stroke volume and poor cardiac output, and people will usually pass out or die. The other variable that affects cardiac output is how much resistance the heart has to work against. So let's imagine that the heart is a bodybuilder. And what do bodybuilders do to gain muscle? Well, they do resistance training. And just like a bodybuilder, the heart has some resistance it has to work against to pump blood out of the ventricle, specifically the left ventricle. And depending on the amount of resistance that the left ventricle has to work against, the stroke volume is going to change. And what we see is that this resistance the heart has to work against, now we're looking at a different variable, and that is called afterload. So afterload is that resistance that the heart has to work against. And many things can affect afterload, but what we see commonly is increased afterload due to stiffening of arteries and the aortic valve. So if you remember the hemodynamics of the heart, the valves have to open, right? Those doors have to open to allow blood to flow through the different chambers of the heart. And we said that this is pressure driven, that flow of blood through the heart. So when we have a lot of resistance from stiff arteries or hardened valves, it increases the pressure and resistance the heart has to work against, and that creates problems. And the relationship here is going to be opposite to what we saw with preload. Here with afterload, what we're seeing is a decrease in stroke volume as afterload increases. So with increased resistance, the left ventricle runs the risk of pumping less blood. And conversely, low afterload will allow for increased stroke volume. And the last factor affecting stroke volume that we will discuss is contractility. You see, the heart is like a shower head. It can contract softly, pushing out a gentle pulse of blood with each beat. Or it can contract with vigor, pushing out a strong flow of blood with each beat. So if we look at two hearts and assume preload and afterload are the same, then we would see the heart with a stronger contractility have a much larger stroke volume. So that is all for the physiology. Now that we understand the physiology, we will move on to discussing how the structure and function of the cardiovascular system is assessed using medical procedures as we see on here. And then finally, we'll discuss physical assessments that we can use to then look at the structure and function of the heart also. That is all for this lecture. See you on the next one.